on the arms, you have to release the legs, right?
He has pain where?
Right tight over here.
Right there.
Right here. So this is like ping pong, right? Small intestine 12 area, and it probably comes all the way over to, you probably feel it in here too. Small intestine 10, not as bad. Yeah. A little bit there. See how it's tight? So you can feel. Go ahead, put your finger there. Feel it.
He was working out too hard.
So he was bench pressing a VW bug, and he accidentally. Now his pain is on what? Extension, turning.
Just everything really. I mean, even this kind of hurts.
So lifting up. But what if you put your arm up and you went up? Does that hurt?
No.
Okay, out.
Not back there. It's over here.
It's over.
But
So
that's something else.
That's something else. Now twist back and forth.
A little bit.
A little bit. Okay. And then come up, shrug the shoulder again, and back. That hurts right there. So that's extension up, right? Trying to extend the arm up. Now, if
So
it's
that
out,
is a UB?
that's going to be up. Bladder.
A bladder.
Foot taiyang, right?
Foot
Then
taiyang.
pull this in. If you pull it in, does that hurt?
No.
No. Okay. And twisting and pulling in doesn't hurt. So if you do this, no. Okay. So do you have? So it's sort of like that.
I will come.
So what's your diagnosis?
So it's going to be taiyang, right? He says a little
right.
bit on twisting, so we could probably say also affects xiaoyang. So in this case, because it's a little bit on twisting and the shrugging, the extension up, I would probably say that you would want to use the, because it's a arm channel, right? It's the arm. You're looking at twisting of the arm in this case, and it's. Do you feel it here more? Or do you feel it on the, you don't feel it at all when you walk, right? You feel it mostly when you move the shoulders.
Right.
So we're gonna say small intestine, so it's probably not UB, that even though the usher points are on UB, the root channel is, started with UB because his legs weren't strong enough to hold it up, but the injury actually lies along small intestine, right? Hand taiyang and hand xiaoyang because of twisting, right? So whenever you treat this, the first thing you have to do is you have to, if you have an issue with the leg sinews, then you release Mingmen, right? If you have, so do 4. If you have an issue with the arm sinews and the legs, or then you would always have to release the legs, do 4, and dajue. Why? Because if the arms are an issue, it means the legs couldn't deal with the load. They weren't able to, move that energy down. They were compromised.
So is that why you asked him, about the leg earlier? You asked him one question.
No,
I
she
can't
just asked
remember.
about the knee, just for another thing to treat.
Oh.
But what I mean by that is like, so if I'm throwing a punch and I'm doing it correctly and I'm here, right, and I'm punching, this is supposed to be relaxed, right, right, and this shouldn't hurt. But if this is not right and I'm throwing from my hand, now it hurts because I'm throwing this all from here, right? It's not concentrated through my foot, right?
Yeah.
So the same idea with like a kick or anything. So it's not coming through. If I'm hitting something, it's not coming from here. If I'm just throwing from here, then this is compromised. But if I'm doing it correctly, then this doesn't feel like anything. The pressure goes down on my foot. So if this is compromised and this isn't holding the support and the weight correctly, kinetically, I'm going to injure this, right? I'm going to injure up top. Same thing you can think of with a car accident. Somebody gets hit, injures the injury in his shoulders, right? He gets hit, he's riding his bike, he gets hit by a car on the right side, up here, maybe, right? His body would never, most likely, be able, unless he was really relaxed, be able to deal with that injury straight on, because the car has so much momentum and accelerated force, right? His legs probably couldn't stop that or do anything like that, right? So we automatically have to assume that the legs, if he injures it in a situation like that, then the legs obviously in that situation were compromised. They weren't able to deal with that type of energy, right? So the first thing we're gonna do is we're gonna check out and release Mingmen, right? So what we have to do here, this is Sam's favorite thing.
This is what we did it, Sam.
So what we do is we want to test to see which side is tighter. So he's totally relaxed here. I'm going to see going in how tight that is. You got to keep the heel down, right? He wants to keep the hip down. You relax. Yep, he keeps the hip down. This is relaxed. We're going to go in. It's a little tight this way, but then we practice coming open, 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 open. It's more tight that way. He can feel it, right? So Mingmen obviously needs to be open. We need to probably work more on going out than in. Sometimes you got to go both ways in something, but we'll test the other leg just to see. All right. So for example, if he was saying I have hip pain on this side, chances are when you lifted the leg, the obstructed movement would probably be on this side. Sometimes you find it on the other, but most of the time it's on the same side. So keep the hip down, come in. Yeah, this is really tight actually on this side. Go out this way. So both sides. So the idea, we'll start on this side so you can see, because we don't have a full amount of time to do this before.
So
we
why do you
start
have to
the
work on the legs?
Because you
he
have
said-
to release Mingmen first. So we're about to do a sinew release that's going to release Mingmen. So in order to do this, you have to do a couple of things. We got time. We have 10 minutes. So you want to put the sinews into a state of extreme yang. Why? Because if you get to extreme yang, it transforms to yin and it'll relax, right? In order to do that, we have to what? We have to confuse his brain. You have to confuse, right? So you have to confuse do 20, right? By Hui, the idea of the liver channel, right? Controlling the sinews, moving to the brain and the top of the head. So you give him a series of exercises that don't make any sense and that are going to take him a lot of concentration to do. So first thing we're going to do to open this up, you see how tight that is going in? So, and you probably feel that tightness in the hip. So this is what you're going to do. You are going to hold pressure against my hand with your knee. Good. Keep your hip on the ground as much as you can. Hold pressure. Now, while you maintain pressure against my hand, you want to, at the same time, move your knee towards your right 5 inches. Keep pressure, though. So what I do is I keep equal opposite pressure on his knee, but he has to constantly come back and press against my hand. Right? He has to focus on both. You notice it kind of quivers. It goes back and forth and back and forth. This is going to actually release his hip. Good. So keep going. Between 3 and 5 inches really is what you tell the person, just so it's a decent amount of movement, right? So keep going. Keep the hip on the ground. Good. Keep going. And it might take a little bit, but this will be the majority of the treatment. Everything else, the other needling is super quick. You might moxa for cold, right? You might do acumoxa for damp, but this is the majority of it to release these points.
Earlier you said the diagnosis was on small intestine, right?
Yes, but you have to release both Du4, Mingmen, and Da Jue to release the upper and lower channels.
For all patients you
For
do
all
that?
patients.
Ah, okay.
Well, if they have an arm issue, then it's both. If it's a leg issue, then it's just Mingmen.
I see.
Keep going.
This is the majority
Keep
of
going
the
to
treatment?
Donna. Yeah. Yeah.
Wow.
The needling is super quick. Keep going. Unless you have mox or something else, if you're just doing needling, super quick. Keep going.
It's a workout.
It is.
Yeah.
For both of you.
Give me good pressure. Go ahead. You got it. Keep it going. You can give me more power than that. There you go. There you go. Keep moving to the right. Keep the hip down. It takes a lot of concentration. So what is this doing? It's bringing that conscious yin, right, the yin level, into the wei level, right? So he unconsciously loses movement. So now he's going to consciously gain it back again. Keep going. You got another 2 inches to go. Keep the hip down.
That's hard.
Yeah. Keep pressure. Keep going. People will get it more and more. Like once after the first day, it's normally the hardest, and then after that, their brain starts to get it, and they figure it out, and they're able to do it much quicker.
You're talking about the practitioners or the patient?
The patient.
Oh.
It's all on the patient, really. I mean, the practitioner's just got to feel what I'm doing so they understand. But once you feel it, like once I do it to you, you'll know exactly how to do it. Keep going. A little more, another inch.
So the problem is if it's a headache, you would do both too, right?
If it's
The
a
same-
Taiyang headache associated with the sinews, yes. Well, if it's a headache along the bladder channel, then no, right? Because it's along the bladder, because I would associate it with that. But if it's something that I'm associating with, say, like if I'm associating it with something that came in the, like if they say it's on extension upwards, then it's probably if it's headache coming up this way, then it's probably on the foot, bladder, or gallbladder channel, right?
Oh, no,
So-
what I mean is, yeah, you said when it's the arm, you have to do both the release on the.
because you're
Mingmen
releasing
and
the arm
both.
sinews.
Right, right.
Yep. Now press
But
on this side. Press on this side. Good. Come. Keep the good pressure. Come. Keep good pressure. Come on. 1 inch back towards me. So I got to make sure his leg doesn't slide. Come back. Good. Now press towards me. Now move 4 inches away. So it might take time, but it's going to bring this ability in his hip to loosen up. And it's going to release the lumbar fascia. It's going to release Mingmen, right? So what is Dumai? Dumai is the source of Yang Qi, right? In order to move Yang Qi out to what? The legs and the arms, you have to have an open Mingmen and an open Da Jue, right? If they're not open, you can't move. So we know this in what? When you look at common TCM treatments today for paralysis, what do they treat a lot of? With needling. They treat a lot of what? Do 4 and do 14, right? A lot of needle. Or for example, kids who are born with cerebral palsy or Down syndrome, they can develop buffalo humps, right? The lack of movement, you can automatically start to see it affect the sinews, the inability of yang to move up and out to the sinews. So the treatment of like do 14 is big. Keep going. Good. Try to keep the hip down. Keep going. You're almost there. Another 2 inches.
No, I'm just starting to rotate.
Okay. Yep. Try to keep it flat. All right. Now watch this. Press against here. All right. 1 inch back towards me. Keep pressure. Good. So you got to try to keep his foot from not sliding, right? You want to try to keep him in a posture. Good. Now we're going to go down. Press hard against me. Press hard away. Press hard in this side. Totally relax now. Watch this. See how much more that opens? Wow. Incredible, right?
That's what I meant with.
So now we're going to work on the outside. So that's on the inside. See how much more that releases?
Yeah.
That quickly. So that's how effective that is. Without doing this, you're not going to be as effective in your sinew treatment, right? So now we're going to go on the outside. So here's the thing. Press here. I'm going to just put this here to keep his foot from sliding. Now keep pressure against me, but move 4 inches towards me. Now you got the idea. You're going a little faster. That's okay. So see how he goes back and forth, back and forth? It's this yin yang, yin yang, yin yang, yin yang, until he gets smaller, 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 and it helps to release, right? You laughing at me?
yin yang, yin yang.
Oh, there we go. There's a reason I don't normally use table paper when I do this, because they slide a little easier, but it's all right. Okay, keep pressure. So he'll notice that I keep equal and opposite pressure against his.
Does he?
Yeah, and that, which makes it tougher, right? If I were doing this, then it's easy, right? But like if I keep equal and opposite pressure, it requires you to go back and forth, back and
Yeah,
forth. On
you're oscillating to maintain it.
Yeah. Keep going. Go ahead, keep pressure. So sometimes if somebody feels weak in the joint, you can cuddle the other joint with your hand, or cup it, give it support, keep pressure. Good, give me more pressure. Good. And what happens is that it just becomes a little more confusing though. If you like move towards my hand on the right, they're like, oh wait, huh? And they get confused because of all the proprioception. So now press here. Good. Move 1 inch back. So the reason we go back and forth is it helps to open it. Move 1 inch back towards Donna. Good. Now press here. Good. Give me good pressure. Move 4 inches down, 5 inches down.
So again, you said if it's on the lower body, you just have to open Mingmen.
Yep.
If it's on the arms and upper body, you have to open both.
If it's affecting the arm channels,
Arm channels, okay.
then you have to open Mingmen and Da Jue. If it's
Da Jue.
only affecting the leg channels, you only have to open Mingmen. Does that make sense? So
Okay.
if it's a leg channel issue on the neck, then you only have to
just do
open Mingmen, right?
What if it's on the head again?
If it's on the head and it's only on the leg channels,
channel of
then
the
it's only
leg?
Mingmen.
Okay.
However, some people might find that opening Da Jue helps to, move more blood upwards and
Anyway,
outwards to the
okay.
head. So I might do that. But in general, the idea is arm channels like Da Jue and leg channels are Mingmen. Good. Good.
So do you suggest, since he injured his shoulder from working out, do you suggest him working out the lower body first?
Yeah, well, that's going to be something that's important to give pressure and strength, So I would, as a martial artist, I do. All right, now press here. Now press on this side. Good. And as you press on that side, 1 inch back towards Donna. Good. Now press on this side.
Whole workout. It's
Yeah.
crazy.
Now give me good pressure and go ahead down, all the way down now. So see, it's opening. You can
For
see it right in
you.
front
So
of you.
you are pushing him down?
No, I'm not. I'm just holding exact
and
pressure
you are
against
trying-
him. And
you
he's
are trying
moving.
to-
I'm trying to force it back.
He's trying to force it back towards me, but at the same time move downwards.
So I'm keeping pressure here against his hand, but I'm bringing it backwards too.
I'll have you feel it later so you can explain it. Go ahead, all the way down now. Keep pressure, good. Now press up hard against me. All right, now relax. Press down hard against me. Now relax. Watch this. Pew. Pew.
Wow,
Awesome,
hello.
huh? See?
Thanks, Marc.
So how's that
You
feel?
do advanced yoga.
It feels really good, right? So this is the way to open it up. Now you might want to, if the other side's tight, you may have to do the other side as well, right? You look at it.
Can you do it on
It's
camera?
it's a little
Not show your face.
it's a little It's a little bit. It's actually a little looser than before, isn't it? Now, yeah. So it even helped to loosen it up. So that would be that one.
Do you want to do it on camera?
Yeah, we can. Here, I'll just.